Hi, everyone. I'm Dr. Noelle Cutter, and I'm going to introduce to you my two research students, Alexandra Federline and Cheyenne Rosado, who worked with me this semester in Bio 4800, and their project focused on the history of breast cancer on Long Island and the impacts of COVID-19. So take it away, ladies.
So Nassau and Suffolk are two counties in New York that are known for their high cases of breast cancer compared to the rest of New York State, as you can see on the graph. And a lot of researchers wonder why. So a lot of studies are currently looking into the environmental factors that surround New York State, such as air and water, specifically Long Island. And a new frontier that a lot of researchers are looking at is COVID-19 and breast cancer. So since the lockdown has caused changes in operations for medical facilities, a lot of, oh my God, sorry.
Okay.
I'm sorry, I just my brain just stopped working. So the lockdown caused by the pandemic has caused a change in operations for medical facilities, including changes in diagnosis and treatment, which may have impacted breast cancer care. So we have three main aims for our project. Since the breast cancer cases among Nassau and Suffolk are so high, we wanted to assess changes in breast cancer treatment and diagnosis on Long Island during the pandemic. Second, since the pandemic has had such a profound effect on everybody, including breast cancer care, we wanted to assess patient perspectives concerning COVID-19 and breast cancer. And lastly, since we know that Nassau and Suffolk have such high cases of breast cancer, we want to review the current literature to assess trends in water and air contaminants relating to breast cancer. So we have three hypotheses. Since we know that breast cancer is in such high numbers in Nassau and Suffolk, we wanted to see how COVID-19 impacted, can you pause it? So concerning changes in breast cancer care during the pandemic, we hypothesized that the pandemic will cause a decrease in breast cancer diagnoses and treatments. Secondly, in terms of patient perspectives, we hypothesize that most patients will report a negative breast cancer care experience.
Since Ali mentioned we have such a high number of breast cancer cases looking into relation to air and water, we found that toxic heavy metal pollution such as cadmium, cobalt, and mercury of water, soils, and air is a major environmental problem, and most conventional approaches do not provide acceptable detection and solutions.
So in order to assess the effect of COVID-19 on breast cancer care, we created three surveys using QR codes on flyers that linked to Google Forms. So one survey was for patients currently undergoing treatment, another was for those in remission, and lastly, there was one for medical facilities all dealing with breast cancer. So the patients, we saw that their numbers in terms of the survey were responding positively. Can you pause it? So concerning breast cancer care and COVID-19, we developed two flyers, and they had QR codes on them that linked to Google Forms surveys. And the Google Form surveys were for patients currently undergoing treatment, those in remission, and for medical facilities. And we saw that a lot of patients and those in remission are responding to our surveys, possibly due to advertising through local breast cancer organizations. In terms of outreach for medical facilities, we mailed flyers to Nassau and Suffolk oncologists that treat breast cancer. And we also decided to call them, but we're still struggling with participation in this area. In terms of the patient and those in remission survey, we are going to run a word emotion association lexicon for patient perspective. So the lexicon will take sentences that the patients or those in remission write, and it will pull out emotions associated with their words that they wrote. So that's how we're going to analyze how the patients have dealt with the pandemic and breast cancer care. And we are currently still collecting responses for outreach efforts.
As you can see, the number of annual cases in both Nassau and Suffolk County are both significantly higher than the other counties. We were very interested in finding a correlation between pollutants in the air and water that could have an effect on our topic of breast cancer. So we've decided to focus our research on Nassau County and Suffolk County. Highlighted in this graph, if we zoom out, even amongst the whole United States, there seems to be a much higher incidence rate in New York State than the other states, suggesting something in the soil, water, and air can have a correlation to this. We found many articles mentioning patients receiving diagnosis within living areas with poor air quality, prior history of cancer, or a different cancer present in the body prior to forming breast cancer. We were very intrigued by the continuous phrase poor air and water quality in many of the research articles we have been reading. Just to clarify, the previous slide went into states, and this map goes into the counties, where the incident rate is 132.8 with a confidence interval of 95%, stating the number is significant. Focusing on poor air quality, areas where there are high levels of metalwork or factories performing metalwork can cause an increase in an individual's chance of disease. In relation to cancer, metal contains both carcinogenic and xenoestrogenic properties, which within studies focusing on metallic fumes, when presented through the air, have been observed to advance or increase the level of tumor size and metastasis. These studies we have been looking into aim to find relevance between metal concentrations and individuals who resided in the area. The National Air Toxic Assessment found concentrations of cadmium, cobalt, lead, manganese, mercury, and many other metals, but we decided to focus our research on cadmium, cobalt, and mercury, seeing as they were the most prominent metals that came up in our research articles. Cadmium and cobalt are used in batteries, coatings, used in electroplating, such as the coverings of keys or kitchen appliances. And the coatings are used to ensure the differential electronegativity to prohibit electrocution when using a toaster, for example. The current leading air advisory for pollutants of the island other than metals include automobile exhaust and out-of-state emission sources being the primary source of ground level ozone and are our most serious air pollution problems in the Northeast. The air quality forecast, it's defined by the AQI or the air quality index, and it just reports the air quality in terms of particles, and that's the amount of trees present in the area. If there is more trees present, then there's an increased production of oxygen and the decreased production of air pollutants presented by the large companies or factories. We are currently researching metal's effects in association to breast cancer. Metal is currently seen to be the greatest pollutant in relation to air of our given locations. Factories are limited to a single 250-gallon tank that stores hazardous waste, and it must be properly examined, noted, and removed from the facility. But as we know, that often doesn't happen and leads to pollution. The heavy metal contamination of both drinking water and rivers with cadmium is present in areas near factories or mines. There is not a direct correlation between cadmium and drinking water in relation to breast cancer. Cadmium is a naturally occurring element, but also comes from tobacco smoke, industrial manufacturing, such as batteries, as I mentioned before, and agricultural activity. It's found in the atmosphere, in our food, soil, and water, and has been associated with multiple adverse health effects. Cadmium is classified as a human carcinogen, and long-term exposure is linked to increased risk of numerous cancers. We are still researching more into air pollution and water pollution, but from our research now, there is insufficient evidence to directly correlate breast cancer and metal exposure, but evidence to suggest that air and water pollution can increase the odds of developing a disease such as breast cancer.
Great presentation, ladies. Thank you so much for sharing that information. Cheyenne, I wanted to ask you, what are some important things you learned from your research experience that will help you in your postgraduate work?
The most important thing that I have learned from this research experience is that sometimes the topic or drive for the research cannot be completed in the way you or your group imagined it to be. And it's important to have other ideas developing to maintain the experience instead of halting the work and waiting for the project you were focused on to succeed. We were originally decided on focusing directly with breast cancer and COVID, but because of the lack of communication between our surveys and the public, we decided to further our research on pollution, which has actually opened my eyes a lot to just a new form of information that has proven beneficial in my current standing classes and future profession.
Awesome. Thank you so much. And Allie, did your research experience change your view of experimental sciences?
So my research experience certainly changed my view of experimental sciences. So I always had the impression that scientific research was a very rigid process, but from this experience, I really found that it is such a creative process, and I found I was able to embrace like my creative nature in this project, and this really helped me feel even more excited to continue this research and further research in my future.
That's great. Thank you so much for sharing this project. And I look forward to working with you more through the summer.